mynews.studio.
Today is February 6th, 2026. Congress has just approved nearly $6 billion to fight HIV and AIDS. The question now is, will this be the funding that finally shifts the global response in a significant way?
That's a substantial sum, $5.88 billion. But how is that money actually distributed? Can we break down where it goes?
Of course. From the total, $4.6 billion is earmarked for direct bilateral support. That means the U.S. works with individual countries to deliver HIV programs. Then there's $1.25 billion going to the Global Fund, which is a collaborative effort among governments and the private sector to address AIDS, tuberculosis, and malaria. And finally, $45 million is allocated to UNAIDS, which coordinates the global response.
So, what's actually new in this round of funding? The U.S. has made big commitments before. What's different this time?
That's a key point. What stands out this time is the direct mention of support for newer interventions, like long-acting PrEP and next-generation antiretrovirals. These options are especially helpful for people who can't take daily medication or where regular access to care is complicated. There's also the framing under the America First Global Health Strategy. It isn't just about leadership, it's also a practical move. If HIV is controlled globally, the risk is lower everywhere, including in the U.S.
Right. So it's not only about how much is being spent, but also about the approach and the tools being used. How does this tie into the 95-95-95 targets that UNAIDS talks about?
The 95-95-95 targets are straightforward but ambitious. By 2030, the aim is to diagnose 95% of all people living with HIV, start treatment for 95% of those diagnosed, and achieve viral suppression in 95% of those treated. This funding is meant to help countries with the highest burden get closer to these benchmarks, especially by expanding new prevention and treatment options.
Where does PEPFAR fit into all of this? A lot of people have heard the name, but maybe not the details.
PEPFAR is at the core. Most U.S. bilateral support goes through PEPFAR, which works directly with clinics, local groups, and health ministries across many countries. There are also mechanisms a bit like the Ryan White program in the U.S., so grants for clinics, community testing, and connecting people to care. It's about more than just providing medication. It's about building the systems that can actually reach and support people.
And the Global Fund? That's more of a joint effort between countries, isn't it?
Exactly. The Global Fund brings together resources from several countries and uses a rigorous grant process. Local communities have oversight to help make sure the funding actually reaches those most in need. The U.S. contribution of $1.25 billion is also meant to encourage other governments to increase their own commitments.
So it's not just about the U.S. writing a big check. There's a leadership component here.
Right. This funding passed with support from both political parties, which doesn't happen often. That sends a message to other governments and the private sector. The U.S. is committed, and others are expected to contribute as well. It's about setting an example and keeping momentum, especially as countries are being asked to increase their own domestic investments.
Are we close to actually meeting those 95-95-95 targets? Or is that still out of reach for most regions?
It really depends on the region. Some countries are making notable progress, but globally, we're not there yet. There are ongoing hurdles: drug resistance, new infections in key populations, and even climate change, which is shifting disease patterns and putting health systems under added pressure.
And what does all this mean for people on the ground? Does this kind of funding genuinely change everyday lives in high-burden countries?
Yes, it does. The funding keeps clinics open, supports regular community testing, and ensures frontline health workers have what they need. Innovations like long-acting PrEP are especially important for people who can't manage daily medication or who face stigma when accessing care. The goal is to make sure these advances aren't just available in higher-income countries, but wherever they're needed most.
So, this is more than a health initiative. It's a test of how countries can work together, isn't it?
That's right. HIV and AIDS remain major global health challenges. This U.S. effort is about saving lives, but it's also about modeling leadership and encouraging broader global action.
We've covered a lot today. How the funding breaks down, the focus on new innovations, the 95-95-95 targets, and what U.S. leadership means in practice. What should listeners take away from all this?
The main takeaway is that the U.S. is renewing its commitment to the global HIV and AIDS response, not just with funding, but with a focus on new approaches and partnerships that could help end AIDS as a public health threat.
That wraps up today's discussion on the U.S.'s renewed push against HIV and AIDS. Thanks for joining us and for staying informed.
Thank you for listening. This episode was brought to you by mynews.studio. Give it a try today.